it became less of a good idea. With respect to the most contentious issue, I'm not sure we can bridge the gap, and that's what we're going to have to explore, and that's the issue of how do we provide coverage not only for people who don't have health insurance right now, but also for people who have pre-existing conditions and are being priced out of the market, or potentially lose their jobs and will find themselves in a situation where they don't get coverage. An interesting thing happened a couple of weeks ago, and that is a report came out that for the first time, it turns out that more Americans are now getting their health care coverage from government than those that are getting it from the private sector. And you know what? That's without a bill from the Democrats or from President Obama. It has nothing to do with quote-unquote Obamacare. It has to do with the fact that employers are shedding employees from health care plans. And more folks, if they can, are trying to get into the Social Security system and the Medicare system earlier through disability or what have you, so that they can get some help. The point that Tom Harkin made, the point that Chris Dodd made, the point that Henry made, and a number of other people made, I think is very important to understand. I did not propose, and I don't think any of the Democrats proposed, something complicated just for the sake of being complicated. We'd love to have a 5-page bill. It would save an awful lot of work. The reason we didn't do it is because it turns out that baby steps don't get you to the place where people need to go. They need help right now. And so a step-by-step approach sounds good in theory, but the problem is, for example, we can't solve the pre-existing condition problem if we don't do something about coverage. Now, it is absolutely true, and I think this is important to get on the table, because we dance around this sometime. In order to help the 30 million, that's going to cost some money. And the primary way we do it is to say that, for example, people who currently get all their income in capital gains and dividends, they don't pay a Medicare tax, even though the guy who cleans the building for him does on his salary or his wages. And so what we say is if you make more than $200,000, $250,000 a year, if you're a family, and your income is from those sources, then you should have to do the same thing that everybody else has to do. Somebody mentioned the fact that we say to small businesses, I think John Kyle, you said, we're taxing small businesses. Look, we exempt 95% of small businesses from any obligations whatsoever, because we understand that small businesses generally have a tough time enough. They don't need any more government burden. What we do say is, if you can afford to provide health insurance, you have more than 50 employees, meaning you're in the top 4% of businesses, and you're not providing coverage, and you're forcing other businesses or other individuals to pick up the tab because your employees are either going to the Medicaid system or they're going to the emergency room, we don't think that's fair. So we say you've got to pony up some. It's not an employer mandate. It just says you've got to pay your fair share, because otherwise all of us have to pick up the tab. And that, by the way, contributes to the overall deficit that Medicaid is running. In fact, most small businesses through this program get huge subsidies by becoming members of the exchange. That's where the money's going. The money's not going to some big welfare program. The money's going to give tax credits to small businesses, tax credits to those who are self-employed to buy into this pool. And that's not a radical proposition. It's consistent with the idea of a market-based approach. And finally, with respect to bending the cost curve, we actually have a lot of agreement here. This is an area where, if I sat down with Tom Coburn, I suspect we could agree on 95% of the things that have to be done. Because the things you talk about in terms of, and I wrote some of them down, in terms of reducing medical errors, in terms of incentivizing doctors to coordinate better and work in groups better, in terms of price transparency, improving prevention. Those are all things that not only do I embrace, but we've included every single one of those ideas in these bills. Now, the irony is that that's part of where we got attacked for a government takeover. Because what happened was when we set up the idea of a MedPAC, which is basically a panel of doctors and healthcare experts who would recommend ways to make the delivery system better so that we can squeeze out that 1/3 in Medicare and Medicaid that's wasted. A Republican idea, that was part of the ammunition you all used to say that the government's going to take away your health care. So if we're serious about delivery system reform, if we're serious about squeezing out the waste that Tom Coburn referred to, you should embrace those mechanisms that are in this bill. I will end by saying this. I suspect that if the Democrats and the administration were willing to start over and then adopt John Boehner's bill, we'd get a whole bunch of Republican votes. And I don't know how many Democratic votes we'd get, but we'd get a whole bunch of Republican votes. The concern, I think, that a lot of the colleagues, both in the House and the Senate, on the Democratic side have, is that after a year and a half, or more appropriately after 5 decades of dealing with this issue, starting over, they suspect, means not doing much or doing the proposal that John Boehner or other Republicans find acceptable. And that it's not possible for our Republican colleagues to move in the direction of, for example, covering more than 3 million people. It's not possible to move more robustly in the direction of dealing with the pre-existing condition issue in a realistic way. It's not possible to make sure that we get people out of a high-risk pool and get them into a situation where, as Tom Harkin put it, healthy people, young people, rich people, poor people, old people, sick people, everybody is part of a system that works. That, I think, is the concern. Having said that, what I'd like to propose is that I've put on the table now some things that I didn't come in here saying I supported, but that I was willing to work with potential Republican sponsors on. I'd like the Republicans to do a little soul searching and find out, are there some things that you'd be willing to embrace that get to this core problem of 30 million people without health insurance and dealing seriously with the pre-existing condition issue. I don't know, frankly, whether we can close that gap. And if we can't close that gap, then I suspect Mitch McConnell and Harry Reid, Nancy Pelosi, and John Boehner are going to have a lot of arguments about procedures in Congress about moving forward. I will tell you this, that when I talk to the parents of children who don't have health care because they've got diabetes or they've got some chronic heart disease, when I talk to small business people who are laying people off because they just got their insurance premium, they don't want us to wait. They can't afford another 5 decades. And the truth of the matter is that politically speaking, there may not be any reason for Republicans to want to do anything. I mean, we can debate what our various constituencies think. I know that I don't need a poll to know that most of Republican voters are opposed to this bill and might be opposed to the kind of compromise we could craft. So it'd be very hard for you politically to do this. But I thought it was worthwhile for us to make this effort. We've got a lot of other things to do. I don't think, Tom, that we're going to have another one of these because people don't have 7-8 hours a day to work some of these things through. What I do know is this: if we saw movement, significant movement, not